Let me tell you something most people your age are never told. Right now, as you're sitting there watching me, blood may not be reaching your feet the way it should. And if that continues long enough, tissue begins to die. I'm Dr. Christina Serrati. Over the years, I've cared for hundreds of patients with advanced circulation failure. And I need you to understand something very clearly: leg loss rarely happens suddenly. It happens quietly, slowly, silently. First the feet feel cold. Then they turn pale or slightly purple. Then walking becomes uncomfortable. Then painful. Then exhausting. Most people assume it's just aging. It's not. Your legs depend on continuous circulation. Your heart pushes oxygen-rich blood down through arteries into your thighs, calves, and feet. Then your veins must return that blood back up against gravity. If that return system weakens, blood stagnates. If your arteries narrow, oxygen delivery drops. If your calf muscles stop contracting, the pump system shuts down. And when those three systems fail together, cells suffocate. At first, it shows up as night cramps, burning feet, heaviness after short walks, slow healing cuts, skin color changes. But inside, something deeper is happening. Your tissues are becoming hypoxic, oxygen deprived. When oxygen drops below a critical level, cells can't repair themselves. The skin thins. Small wounds don't close. Bacteria thrive in low oxygen environments. Infection sets in. And here's the truth that may surprise you: by the time ulcers appear, circulation has already been failing for years. The body gives warnings long before crisis. Cold toes, shiny skin, hair loss on the legs, pain that eases when you rest, feet that change color when elevated. These are not random symptoms. They are signs your vascular system is under strain. But here is the part most doctors don't emphasize enough: circulation is dynamic. It can improve. Blood vessels are living tissue. They respond to stimulus. They adapt. They grow. And today, I'm going to show you 4 specific movements that activate the exact physiological mechanisms required to improve arterial inflow, enhance venous return, stimulate vessel dilation, encourage new vessel formation. But before we do them together, you need to understand the 3 circulation principles that determine whether your legs thrive or deteriorate. Because when you understand the mechanism, you perform the movement correctly. And that makes all the difference. In the next section, I'm going to explain exactly what fails inside the vascular system, and why sitting for long periods accelerates it. Then we'll begin the first movement together. Let's talk about what is actually happening inside your legs. Your cardiovascular system is a closed loop. Your heart pumps blood through arteries. Those arteries branch into smaller arterioles. Then into microscopic capillaries that feed every cell. Then the blood must travel back through veins, upward, against gravity. For this system to work properly, 3 things must function well. Keycap 1: open, flexible arteries. Arteries must remain elastic and wide enough for blood to pass freely. But as we age, inflammation, plaque buildup, and endothelial dysfunction stiffen and narrow those vessels. This reduces oxygen delivery to muscles and skin. This is called arterial insufficiency. Keycap 2: functional venous valves. Inside your veins are tiny one-way valves. They prevent blood from sliding backward. When those valves weaken, blood pools in the lower legs. Pressure builds. Swelling appears. Skin darkens. This is venous insufficiency. Keycap 3: working calf muscle pump. Your calf muscles are not just for walking. They are your second heart. Every time you contract your calves, deep veins are compressed. Blood is pushed upward toward your heart. When the muscles relax, veins refill. This cycle prevents stagnation. But here's the problem. After 60, most people sit far more than they move. When you sit, calf muscles remain inactive. Venous blood pools. Oxygen delivery slows. Endothelial cells become sluggish. Capillaries begin collapsing from lack of pressure changes. Over months and years, this creates a perfect storm: less blood coming in, more blood staying trapped. Weaker muscle pump. Tissue begins to struggle. And because this happens gradually, it feels normal. Cold feet become just part of aging. Leg heaviness becomes I'm just tired. Short walking distance becomes I'm slowing down. But inside, circulation is deteriorating. Now here's the empowering part. Blood vessels respond to 3 powerful physiological triggers: heavy checkmark hydrostatic pressure shifts, heavy checkmark muscle pump activation, heavy checkmark ischemic stimulus, controlled oxygen deprivation. When used correctly, these triggers increase nitric oxide production, improve endothelial flexibility, recruit dormant capillaries, stimulate growth factors like VEGF, encourage collateral vessel formation, and we can activate all three in under 15 minutes. No machines. No medication. No gym membership. Just precise movement. In the next section, we begin with the first technique, the one that immediately flushes stagnant blood and forces fresh oxygenated blood back into your legs. You'll feel the difference within 60 seconds. Get ready. This first movement is simple. But physiologically, it's extremely powerful. Right now, if you've been sitting for a while, there is likely a significant volume of deoxygenated blood pooling in your lower legs. Gravity keeps it there. Your veins stretch under that pressure. Oxygen levels drop in the surrounding tissues. We're going to change that in 1 minute. Lie down on your back. If the floor is uncomfortable, use your bed. Move close to a wall. Now raise your legs straight up so they are perpendicular to your torso. If possible, rest them against the wall. Scoot your hips as close as you comfortably can. Keep your knees straight. This position places your legs above your heart. And the moment you elevate them, gravity reverses. Blood that was pooling in your calves and ankles begins draining back toward your torso. Venous pressure decreases. The stretched vein walls begin to decompress. Hold this position for 60 seconds. As you hold, you may notice tingling in your feet. That's normal. You may feel your legs becoming lighter. That's the volume of pooled blood shifting centrally. What's happening internally is important. When veins empty, they partially collapse. This creates a temporary low-pressure environment in the lower leg vessels. In a moment, we'll reverse gravity quickly. And when we do, fresh oxygenated blood will rush back in. That rapid influx is called reactive hyperemia. Reactive hyperemia increases shear stress along the vessel walls. Shear stress stimulates the endothelium, the inner lining of blood vessels, to release nitric oxide. Nitric oxide relaxes and widens blood vessels. It improves circulation almost immediately. You're not just draining blood. You're retraining your vascular lining. Keep holding. You're almost at 60 seconds. Now, carefully but quickly, sit up and lower your legs to the floor. Feel that warmth? That sudden heaviness? That wave of heat traveling downward? That's oxygen-rich blood re-entering vessels that were just emptied. This flush improves capillary perfusion and temporarily enhances arterial inflow. If your legs feel warm and slightly full, that's a good sign. Your vessels are responsive. If you felt little change, that tells us your vascular reactivity may be reduced, which simply means you need to perform this movement twice daily to restore responsiveness. This first movement clears stagnation. But now we need to prevent blood from pooling again. For that, we activate your second heart, your calves. In the next part, we turn your lower legs into powerful circulation pumps. Now that we've flushed the pooled blood out and brought fresh oxygen back in, we need to keep it moving. Because circulation is not just about inflow. It's about return. Sit upright in a sturdy chair. Place both feet flat on the floor. Knees bent at 90 degrees. Back straight. Now listen carefully. Deep inside your calf is a muscle called the soleus. Most people never think about it. But in vascular medicine, we call it the second heart. Why? Because every time it contracts, it squeezes the deep veins running through your calf and propels blood upward toward your heart. When it relaxes, those veins refill. That cycle prevents blood from pooling. But when you sit for long periods, that pump shuts down. Venous pressure builds. Valves weaken. Swelling increases. Skin darkens. Tissue oxygen drops. We're turning that pump back on right now. Keep your toes planted on the floor. Lift your heels as high as you can. Squeeze your calves at the top. Then drop your heels back down. That's 1 repetition. But we're not doing this slowly. We are pumping. Because we're not building strength, we're moving fluid. When you contract rapidly, you create repeated compression of deep veins. Each contraction pushes a small volume of blood upward. The faster the rhythm, the more circulation you stimulate. We're going for 30 seconds. Start now. Lift. Drop. Lift. Drop. Quickly. Pump those heels up and down. Keep your toes anchored. Feel your calves tightening with each lift. You should begin to feel warmth building. That warmth is increased blood flow. Nitric oxide is being released. Venous return is accelerating. Your heart is receiving more blood from below. Keep going. Halfway there. You may feel burning in your calves. That's normal. That mild burn means the muscle is working and demanding oxygen. Your body responds by dilating nearby vessels. 10 seconds left. Pump faster. Strong squeezes at the top. 5, 4, 3, 2, 1. Stop. Sit still. Don't move. Place your hands on your calves. They should feel warmer. Maybe even slightly throbbing. That pulsing sensation is improved venous flow and arterial response. If you felt heat and pressure, your calf pump is functional. If you felt very little, that simply means your muscles need retraining. Perform this every hour during the day when seated. This single movement alone reduces venous pooling dramatically. But now we need to address arterial growth. Because improved return doesn't matter if inflow is restricted. In the next section, we trigger one of the most powerful biological mechanisms for growing new blood vessels. And yes, it involves discomfort. Up to this point, we've improved drainage and enhanced venous return. Now we focus on something deeper. We stimulate your body to build new blood vessels. Stand up. Make sure you have stable footing. If needed, stand near a wall or counter for balance. This movement is a controlled marching drill, but done with intention. Here's why. When muscles are deprived of oxygen during sustained effort, they release a protein called vascular endothelial growth factor, VEGF. VEGF is a signal. It tells your body, this area needs more blood supply. In response, your body begins forming new capillaries. Over weeks, those capillaries mature into collateral vessels, alternate pathways that bypass partially blocked arteries. This is not theory. Supervised walking programs for people with peripheral artery disease use this exact principle. But the key is intensity. Mild effort won't trigger enough stimulus. We need controlled, safe discomfort. Now begin marching in place. Lift your right knee as high as comfortable. Then your left. Right. Left. Right. Left. Drive your knees upward with purpose. Swing your arms naturally. This is not casual walking. You are activating your hip flexors, quadriceps, calves, and glutes. You should begin feeling your breathing increase within 30 seconds. Keep going. At around 1 minute, your thighs may feel heavy. That's oxygen demand increasing. Your heart rate rises to deliver more blood. Keep marching. If safe for you, lift your knees slightly higher. This intermittent compression and release of arteries creates a pumping effect. Blood flow accelerates. Shear stress increases. Endothelial cells respond. At 75 seconds, you may begin feeling a burn in your calves or thighs. That's controlled ischemia. That discomfort is the signal for VEGF release. Do not panic. This is not joint pain. This is muscular fatigue. If you feel sharp joint pain, stop. But muscular burn? That's therapeutic. Push through for 15 more seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Stop. Place your hands on your thighs. Take deep breaths. Your legs may feel warm, heavy, even slightly shaky. That shaking is neuromuscular fatigue. Over the next 24 to 48 hours, your body responds to this stimulus. If performed daily, measurable vascular improvements can begin within weeks. But consistency is critical. Now we protect the most vulnerable area of all, your toes. Because that's where serious circulation problems often begin. In the next part, we focus on the smallest vessels, the capillaries, and how to keep them open. Most serious circulation problems don't begin in the thigh. They begin in the toes. Why? Because your toes are the farthest point from your heart. Blood pressure is lowest there. Capillaries, the tiniest vessels in your body, must stay open to deliver oxygen to the skin and nerves. When circulation declines, these microscopic vessels are the first to collapse. That's when people notice cold toes, pale or bluish discoloration and numbness, slow healing cuts, thickened or brittle nails. If capillaries close and stay closed, tissue becomes oxygen deprived. And prolonged oxygen deprivation leads to tissue breakdown. So now we activate capillary recruitment. Sit down again. Place both feet flat on the floor. Imagine there's a small towel under your toes. Curl your toes tightly as if grabbing that towel. Hold for 1 second. Now spread your toes as wide as possible. That's 1 repetition. We're doing 40. Start now. Curl. Spread. Curl. Spread. Make each movement intentional. You should feel small muscles working along the arch of your foot. Those intrinsic foot muscles are rarely used, but they are powerful capillary pumps. Each curl compresses small vessels. Each release allows fresh blood to rush in. This repetitive compression keeps capillaries open and responsive. Keep going. At around 20 repetitions, you may feel slight cramping in your arches. That's normal. Those muscles are waking up. That mild burn is increased metabolic demand, which improves blood delivery. 10 more. Curl firmly. Spread fully. Full range of motion. 5, 4, 3, 2, 1. Relax. Wiggle your toes gently. Notice how they feel. Warmer? Tingling? More alive? That tingling sensation is increased microcirculation. If your toes feel warmer and pinker, that's a positive sign. If they remain very cold or discolored, perform this exercise several times daily, especially if you sit for long periods. Now listen carefully. You've just activated heavy checkmark hydrostatic drainage, heavy checkmark venous muscle pump, heavy checkmark arterial shear stress, heavy checkmark vague stimulation, heavy checkmark capillary recruitment in under 15 minutes. But this is not a one-time fix. This is a daily vascular routine. Morning, evening, consistently. Circulation improves with repetition. Your blood vessels adapt to stimulus. They strengthen. They dilate more easily. They grow when properly signaled. If you commit to this routine for 30 days, you may notice warmer feet, reduced cramping, a increased walking distance, a better skin color, a improved energy in your legs. Now I want to ask you something important. Did you feel warmth after elevating your legs? Did your calves burn during the pumping phase? Did marching make your thighs heavy? Did your toes tingle afterward? Comment below and tell me what you experienced. Your feedback keeps you accountable, and it helps others feel confident enough to start. If this helped you, share it with someone who complains about cold feet, leg pain, or poor circulation. And subscribe. Because on this channel, I teach practical, physiology-based strategies to protect your health as you age, clearly, honestly, and without gimmicks. Your legs carry you through life. Take care of them. I'm Dr. Christina Serrati. And I'll see you in the next video.